Newsroom tonight, the CDC is set to shorten the recommended length of time you should be in quarantine if you've been exposed to the virus. So this essentially means that if you've come into contact with someone who is infected, you can go back to your normal activities after 10 days, 7 if you receive a negative test result. That is down quite significantly from the 14-day period the CDC has been recommending since the beginning of this pandemic. Joining us tonight is Dr. Andrew Carroll, a family medicine doctor with Banner Health. Doctor, thank you so much for your time tonight.
Hi, how are you doing?
Good. I just want to ask you, full stop, do you agree with these new CDC guidelines? Any concerns at all?
Well, I do have concerns because there's still people out there who are asymptomatic, who people don't have symptoms, and yet they have the virus and they're transmitting it. What's really important is the other guideline, which is to be retested at 7 days. I think that's really the only way to reassure that 10-day quarantine is an appropriate period of time. So if you're even considering that 10-day return to activity, try to have that test done at 7 days. I think that's really important.
And Doctor, I know you've looked into this more than we have. Is there any information in the CDC, these new guidelines, that you understand, that you think that we should know about, that helps us understand why this quarantine time is now down 4 days?
So I think that part of it is knowing more about how many people end up being asymptomatic, or how many people are coming into contact with COVID positive patients who then end up with illness. And I think they're just looking statistically at those numbers and coming up with the 10 days as a return to activity as a safe point. However, I think that it's probably a little too generous, I think. I think the 14 days is still important because I'm seeing patients that are 10 to 12 days out before they develop symptoms. I'm concerned that returning people to work at 10 days might unnecessarily expose others at their workplace to the illness. Again, there's a lot of availability of testing. If you go to azdhs.gov, look for free testing sites and get tested before you return to work. I think that's so important.
Doctor, I got to ask you this, though. Do you think that testing has gotten better? Because if you go by this new 7-day policy, if you get a negative test back, the problem is with the surge that we're seeing right now, more people are waiting in line to get a test. It's now taking the labs 3 to 4 days sometimes to get those test results back. Is that a concern to you that we don't have enough rapid tests available out there on the market?
Well, it is a concern, of course. In our office, we're seeing 24-hour turnaround time, which I think is fantastic. This time, like I said, on Monday we had a patient who came in sick. Tuesday we had a result, and that was a Thanksgiving exposure. So we're telling people very quickly, at least in my clinic, that they are sick and they should isolate for the next 10 to 14 days. I don't know about the testing sites, the free testing sites, but because they've been so overwhelmed, that's why it's taking so long to get testing. So I encourage everybody that if you want to be tested and you have a private practice physician, call us first because we can usually get the test done quickly. And I even have run out of tests, but I even have the test that I can do in 20 minutes and have an answer for you, and with a high degree of accuracy. But again, I'm having trouble getting those tests in my office as well.
Well, I think it's good to know that you can call your family doctor. I don't think a lot of people know that. So thank you for that information. I do have one more question. So now that doctors know more about this virus than they did, say, back in March, there has been so much changing information about quarantining, about types of exposure, about symptoms and things like that. Is it possible that there is so much information going out there to the layperson? I mean, doctors understand the changes, but do you think that's making it hard for communities to be on the same page when it comes to safety?
I sure do. You know, as we see more of the illness, and this is the same in everything in science, the more we learn, the more we know. And it's not until we see enough cases of something that we actually know, one, how to manage it and prevent it, but also how to treat it. So that's why you're seeing the mortality rate starting to drop, is because we've learned so much more about the illness. Some of the better places to go, azdhs.gov has a great website that helps to boil things down for Arizonans. The CDC also has a website. And then your doctor probably has a lot of good information for you as well. At my practice, we give out an email that just boils everything down very simply for patients to understand. So call your family doctor or tap into those websites because those will really keep it succinct for everybody.
AZDHS, we will link that to ours. I think we already have a link. Are you getting any sleep these days?
Not much, but it's going to be all worth it at the end once we get through this, obviously.
All right, Dr. Andrew Carroll, thank you so much. That information was very good for our viewers and for us, quite frankly. So thank you for that.
Yep, absolutely. Have a good evening.
You too.